I knew in high school that I wanted to be a doctor. I took my first biology course when I was a sophomore in high school, and it was like love at first sight. I absolutely fell in love with studying biology, and I had a pretty limited idea of what people could do with biology, and the only thing I could come up with was being a doctor. And as soon as I thought of it, I knew that that's what I wanted to do, and I never lost that passion and drive to make it happen. So I went through pre-med in college and got accepted to Georgetown Medical School, and the rest was history. Georgetown also was a very expensive school, so I took advantage of a U.S. Navy scholarship, which paid my way through med school in return for working for the Navy for a few years. So I ended up being in the Navy for 8 years, and that really shaped a lot of my ideas about healthcare delivery, my experience in the military, because it was a system that made sense. There was not all these complicated financial incentives and disincentives for the way we deliver health care. Standards of care and clinical decisions were made by health experts. Healthcare was delivered in teams of doctors, nurses, physical therapists, nutritionists, psychologists. No money ever changed hands. You just showed your ID and you were in if you were a patient. So it was a remarkable way to practice medicine. And in fact, at the time, I didn't even realize how remarkable it was because I didn't know anything else. And it wasn't until I made the leap from Navy medicine to civilian health care that I really experienced a culture shock in terms of practicing medicine really for profit and for all the wrong kinds of incentives that were built into the system, and especially all the inequities that were built into the system. I think when people over-access the healthcare system, it's usually because they don't understand what it is that those health providers can do or not do for them. I don't think people enjoy going to the doctor. I don't think they enjoy sitting around a waiting room to be seen for sniffles, but it happens a lot because people are worried. And they oftentimes don't know where to get advice other than to access the most expensive tier of health care. And one of the things we did well, at least in my experience in the Navy, was triage. So nurses, well-trained, caring nurses would triage or handle a lot of the simpler problems. In pediatrics, one of the most important things you need to be able to do is reassure parents and let them know when they don't need to be worried. You don't necessarily need a doctor's appointment in order to have that happen. And we used nursing staff very effectively, I think, for that. The problem with our civilian healthcare system is that for many people, the only way to access the system, even if it's for sniffles, is not only to go see a doctor, but to go to an emergency room, which is extremely expensive and just not a healthy place to be if you don't really need to be there. So the problem of being too quick to access medical care, I don't think is unique to either civilian or military care, but what you need is a lower tier of care, somebody other than someone with an advanced medical degree, to be able to help parents distinguish when their children actually really need intervention. And that's important to do. It's almost impossible to do in a healthcare system that codes by diagnosis and will only reimburse if a doctor sees you. From my perspective and in my experience, I think we see more of those issues in our private healthcare system than we did in the military. After I'd been in the Navy for 8 years, I had my first child, my daughter, mothering became yet another responsibility and joy and passion that I took on. And we were ready, my husband and I were ready to settle down. I mean, the Navy was a wonderful way to practice medicine, but your patients change every year or even sooner. You know, they're constantly shipping in and shipping out. And also, doctors don't tend to stay in one place very long. So we were ready to settle down, find a home somewhere and live there and raise our children. And so that meant getting out of the Navy. I had been a pediatrician for 8 years. I had been taking care of the children of active duty servicemen and women. Then I had been in Japan, I moved back to the States, and so I was already a seasoned pediatrician, and in fact had been relying on all the training that I had had. We had a huge responsibility in the Navy for some very complex diseases. Working in Asia, I saw all kinds of illnesses that I would have normally seen in the States. It was a very exciting, very demanding, very challenging practice. Then I moved back into the States and worked first in an HMO and then in a community health center, where the culture was very, very different. Most of the patients I was seeing were for either health maintenance or well child checks or for very minor illness. And even back then, the culture was very much that if anything more complicated arose, the standard of care was to send you off to a specialist or order lots of tests. Parental expectations were very, very different. As I came face to face with health benefits that were part of employment, patients had sort of morphed into healthcare consumers who very understandably, wanted their money's worth. And unfortunately, in the American psyche, that often means that more is better. So the more health care you get, the more intervention you get, the better. So there really was this shift, this culture shock from coming from the military, where it seemed like clinical decisions were based on medical science, to the civilian system, where people in general were very aware of how much health premiums and health benefits were costing them, even if not directly. Just you can't change a job because you'll lose your health benefits. And so parental expectations became very much tied to getting your money's worth and expecting intervention. And you could see how that shaped the way physicians responded in their practice. I think for me, the biggest tipping point was the expectation that the pediatrician was there for every facet of child rearing that has plagued parents since the dawn of the ages. So I spent so much of my day discussing naps, or whether to start strained carrots before strained peas, and not that these aren't important questions, but they're really not what a doctor is trained to do. And in fact, I'm pretty sure in my entire pediatric training, we never once talked about whether you should start strained carrots before strained peas. But this is how my day would be spent in private practice. And one of the jokes around the office was that if a parent came in and asked a question that we didn't know the answer to, we would just run and find a nurse and say, so what do you do when a kid gets, hair wrapped around their little pinky and you can't get it off? Or we would pick up a copy of Parenting magazine from the waiting room and see what they had to say about when you should start solid foods. And we could pass along that information to our parents. But there really was just this huge discrepancy between what we were trained to do and what we were actually being paid to do, which was really to offer a lot of reassurance and child rearing advice. And then complicating that was when you go to see the person who can write a prescription for every health question, you're so much more likely to get a prescription. And so one of the classic examples I use is reflux medicines for babies, what used to be called spit up. as I say in my book, as soon as it turned into more syllables, gastroesophageal reflux, then it required a prescription. The level of intervention just escalated. That was driven to a large part by pharmaceutical marketing. So parents would open that same, Family Circle magazine or something and see full-page glossy ads for the prescription medicine that will make your baby's spit up go away. So it became harder and harder to not intervene. And I think probably the single most frustrating part of certainly my evenings on call was trying to convince parents that their child didn't need antibiotics. That more often than not, that was seen as being dismissive or not caring or not taking their complaints seriously. So I spent so much time trying to convince parents, often unsuccessfully, that really your child does not need all these cold medicines. They do not need these antibiotics. Not only not convincing the parents, but feeling very disrespected in the process. Being a pediatrician was something I had wanted so badly for so long and really enjoyed for so long up until this point that it never really occurred to me, well, maybe I should just do something else. And it wasn't until I happened to have a conversation with a teacher at my daughter's school. My daughter went to an independent school, which cost tuition, and the teacher mentioned to me that many of the faculty in the science department had previous careers, veterinarians, different sorts of careers, and that teaching science was a second career for them. And she said, and by the way, do you know if you teach here, your daughter goes here tuition free? And I thought, oh, yeah. And then on the ride back down to my office, rushing down to my office to see my patients of the day, I thought, could you really leave a medical practice to teach high school? It just seemed like such a crazy idea. But over the weeks that followed, I couldn't get the idea out of my head, and I thought, you know what, maybe I should do this just for a couple of years. I was so tired. I'd felt so little joy in what I was doing anymore, and I saw no real hope for change. I mean, we had the healthcare system we had, just changing practices or something wasn't gonna help that. So I finally decided, you know what? Why not? For a couple of years, just try it. Try something different. And it was very scary. It was very painful. But boy, once I decided that that's what I was going to do, it really wasn't until then that I realized how unhappy I had been and how tired I was. I felt the weight of the world lift. Primary care is probably the most frustrating and underpaid direction you could go in if you want to practice medicine. And so many doctors are just finding other things to do other than primary care. And certainly if you look at the residents coming out of med school these days, they want to go into radiology and dermatology. It's family practice especially it's becoming very hard to fill those positions. So doctors, in a sense, are talking with their feet. And then even mid-career doctors, they're less likely to leave their practice to go teach. One reason being financial. But they oftentimes, I know many of my colleagues who even later in their careers have done specialty fellowships or just gone into more of the business end. Many women, I think women are more likely to go part-time, and that can help save your sanity and get you a little bit more sleep. So people are finding various ways to cope. Certainly most people are not making as dramatic a change in their lives as I did. But I was really struck after I made my decision and went public with it. I was really struck at how many doctors from all different specialties sought me out and kind of bared their souls to me, and I realized how pervasive it was that doctors who should have been at the peak of their careers were so sad, so tired, so disillusioned. It was really striking. I think one of the things you feel when you're going through this is that you're the only one, because there's this myth about doctors in our society, that we have it so good and our work is so noble. And so when you're in that, when you're inside that myth and you're unhappy, you think, well, what's wrong with me? And so doctors don't talk about this very much. At least they don't talk about it until somebody breaks away and it's safe to talk to them. But for years now, even when I go to a doctor myself or bring my children to a doctor, instead of talking about the reason for the visit, we end up talking about medicine and how hard it is to just keep up the daily battles. So a couple of things happened. One is I absolutely loved teaching. That never felt like just plan B, well, I guess if I can't do what I really want to do, I'll teach. It never felt like that. I love teaching. To this day, I love teaching. I'd be excited every day to go into school, and it felt so good not to be exhausted all the time and to really enjoy teaching. It also, then I had the time to write, which I had never had before in my life, and I loved it and spent a great deal of time writing, and I knew that that's something I could not do if I was back in full-time pediatrics. However, writing about medicine and healthcare also clarified for me, brought back to me the things that I really loved about medicine and the things that I missed, and I'll always miss the ability to practice medicine. I couldn't go back to the situation that I was in, but I thought this would be a great chance to volunteer in clinics. I had summers off, and I thought, boy, what if I used some of that time to use some of these skills that I had and do it in a setting where I wasn't feeling like I was necessarily banging my head against the wall, but just volunteer in like an inner city clinic where my skills were really needed and I could feel like I was doing something good. But the biggest obstacle to that was malpractice insurance. And I certainly couldn't afford to pay my own malpractice insurance, and could not find a practice opportunity where they would be willing to, where they were able to get malpractice insurance for me. And so that, it turns out, after staying out for a few years, that turned out to be a one-way decision. I closed a door behind me, and I didn't really realize that I'd closed it. I'll always be grateful that I had the chance to not only to practice medicine, but for a big portion of that career to really feel like I was practicing medicine and making the most of medical science. So I'll always be grateful for that. My daughter once asked me, "Are you sorry you went to med school?" And I answered in horror, "No, of course not. If I'd never been a doctor, I can't imagine even how that would have felt." So I'll always appreciate the chance that I had to practice medicine. But if I had kept on, that means I never would have taught chemistry, and I love doing that. And I never would have had this whole world of writing open to me. I've loved writing the book. I've loved writing about healthcare issues in general. So do I regret that I can't do everything? Yes, but I feel very fortunate that I've had the chance to do this variety of things that have all been very meaningful to me, that I've been able to feel passionate about.